Okay, so thank you all for being here and welcome to CalWORKs as a prevention partner workshop. I'm Stuart Oppenheim from the Child and Family Policy Institute of California, and I'm just here to introduce this. I see that you all agree with me that really understanding the fabulous resources that come to us through CalWORKs really support all of our prevention efforts in California, the comprehensive prevention services plans that you're doing. We're hoping that everybody has already engaged their CalWORKs partners as part of their prevention efforts, but if not, this should be an inspiration. Our presenters today are from the Department of Social Services, Lisa Witchey, who's the branch chief of CalWORKs and Family Resilience Branch at CDSS, Damien Ladd, who's the bureau chief of the Engagement Bureau at CDSS, Robert Mikel, who's a program manager in Madera County, and John Dufresne, who's a program manager in Madera County. So we're going to hear about a little bit from CDSS about the fabulous resources that are available for families, and then hear from Madera County as one county that has actively engaged CalWORKs in their prevention efforts. So with that, I'm going to turn it over to, I think, Lisa, are you going to start?
I sure am. Thank you. And good morning. After hearing the number of really fantastic sounding presentations, I was worried that we would be here in a room all by ourselves. So thank you for voting with your feet or your buttons to come and spend some time with us this morning. We are thrilled to be here sharing some information with you all about the CalWORKs program and opportunities to partner in prevention planning, and you're thinking about strategies, revenue sources, services and supports to leverage as we're thinking about how to support families and meet their needs. So that's what you are in store for this morning. I cannot see the slides, so I don't know. Oh, look at that. Okay. So first off, just want to share some data with you all to kind of make the case and also give a call for, I think, the opportunity that this data presents to us. So first, what we're looking at here is some matched data sets. So this data is from Q2 of 2022, so mid-year 2022. There were 912,809 CalWORKs recipients, as you see at the bottom. There were 355,000 plus individuals who were referred to child welfare services. So those are the numbers that we're starting with, and then it sort of matches as you go forward. So what we're seeing here is that 55,000 plus individuals were linked between the two populations, with 6% of the population being referred to child welfare services and 15.5% of the child welfare services population being in CalWORKs. So those are pretty significant numbers. And I think as we go on in the presentation, we're going to be making the case that potentially these numbers could be higher. So when we're thinking about families who are involved with child welfare or at risk of involvement, that's an opportunity for you all to be thinking about CalWORKs as a partner, a partner in providing services and supports to help strengthen families and give them additional resources. So that is the beginning of our call to action. In the next slides, I stole some information from Chapin Hall. And many of you have likely seen their brief on concrete and economic supports. So apologies for the duplication for those of you who have seen it. For those of you who have not, highly encourage you to take a look at it. Chapin Hall did some research and analysis regarding the impact of concrete and economic supports as a strategy to prevent maltreatment and involvement in the child welfare system. And so that's some of the information that I'm going to call out briefly before we share more information about what the CalWORKs program offers. So jumping into that, you see some stats here about more than 60% of maltreatment determinations being regarding neglect. In California, that's actually higher. So this data is national data, 60%, but I think California's, don't quote me on this, but I think we're at least 10 percentage points higher on that. And then families below the poverty line being 3 times more likely to be substantiated for maltreatment. Root causes of child maltreatment, including poverty-related risk factors, such as employment, single parenthood, housing instability, and early childbearing and lack of childcare. Those are all root causes. They're not causes of maltreatment for sure, but what happens is the stress that families experience builds when they are dealing with these many factors, and it lowers resilience that families have. So really key for us to be able to address those root causes. And I think we want to make the case around leveraging economic supports as an opportunity to promote child and family well-being and prevent maltreatment. Another piece that I want to reinforce here is that families who are experiencing poverty and economic insecurity do tend to have higher rates of child abuse and neglect. But our current data reporting makes it very difficult to parse out the problems as to whether they are solely related to poverty or other stress indicators. And we'll move into the next slide, again, borrowed from the, or stolen, from the Chapin Hall brief, which I think somebody put in the chat, and thank you for that. So this is the theory of change, showing the relationship between economic and concrete supports and the prevention of maltreatment, which is just one component of improved child and family well-being. Many of the frameworks that have emerged around this demonstrate the essential support of concrete and economic supports as an essential prevention and protective factor. So the Strengthening Families framework is one of those, calling out the basic necessities that everyone deserves in order to grow and thrive. Similarly, the Essentials for Childhood framework also calls out the concrete and economic supports as well. And then moving into the next slide. So this slide gets into recommendations, again, very nicely laid out in the Chapin Hall research, showing the various domains regarding data, policy, programs, and engagement, and leveraging the expertise of individuals who have lived experience in the programs. When economic interventions have been tested, even modest financial supports are shown to reduce child abuse and neglect by enabling families to better access resources that address their own basic needs, particularly when we are putting families in the place of experts and trusting them as identifying their own goals and what their needs are, rather than dictating, what are the issues that need to be resolved as determined by our systems. The last piece that I'll touch on regarding the CalWORKs program as it relates to the Chapin Hall research is specific recommendations that were uplifted in the brief related to housing subsidies, child care vouchers, addressing food insecurity. There's even mention of providing guaranteed income. And this piece that I think our linkages program touches on, for those of you who are familiar with that, is the opportunity to redirect some families or catch some families early as they're coming through the hotline and referring them for concrete and economic supports through the CalWORKs program. So with that, I will turn it over to Damien to talk more specifically about the services and supports that are provided in California's CalWORKs program.
Great, thank you, Lisa. Hi, everybody. My name is Damien Ladd. I'm with the CalWORKs program here at CVSS. And you can maybe jump on over to the next slide, whoever that person is. Yeah, here we go. So I am going to just provide a little bit of a high-level overview of some of the services and supports that CalWORKs offers as our Madera partners present their information. I think you'll see a little bit more specifically how some of these services and supports can be operationalized, at the ground level. So I'm just going to be speaking relatively briefly. And so for that reason, if you have the urge to take yourself off of mute and say woohoo, you just limit that to 1 or 2 tops per individual, be appreciated. I'm just going to be on here briefly. If we had a longer amount of time, I'd say just go ahead and do more. But for the sake of time, let's just limit it to 1 or 2. So broadly, CalWORKs provides cash aid and services to needy families. So certainly in the area of concrete supports, we can think of cash aid in that arena. We have several components to the program, an array of services that I think are both innovative and helpful as the CalWORKs program has sort of shifted away over the last several years from being a real work-first oriented program to today a program much more in tune with the needs people have and the services that we think can help them build resiliency and build towards a brighter future. So that includes a home visiting program, various employment and training activities, housing supports, immediate need when needed. Certainly mental health, substance abuse, and domestic violence services are something that folks can use. Madera's going to talk a little bit more, I think, in slides to come about how they're utilizing subsidized employment. And so generally speaking, I would say CalWORKs is one of our, it's one of the state's cornerstone social service safety nets, I think, along with Medi-Cal and along with CalFresh benefits. I'll kind of stop there. I'm going to assume most people have a general idea of what CalWORKs is, and we can go ahead and go on to the next slide. And so here you'll see how some of the CalWORKs services and supports that we offer sort of fit into that linkages model of primary, secondary, and tertiary prevention. So, just a little brief background on linkages. Again, I'm assuming most folks are generally aware, but that, the original iteration of linkages from several years ago was really focused in this third column here, sort of the tertiary aspect of getting to those crossover families that Lisa showed some in that data, 55,000 or so, only after that there had been a more severe intervention by child welfare services and families were looking to reunify, and certainly the wisdom of linkages in in those situations is patently obvious. As we've sort of launched what we've been calling Linkages 2.0, you know, it would have been a real missed opportunity if we didn't focus a little bit more on primary and secondary prevention. And so here's where the CalWORKs program, if we look to the left in this column, primary prevention, you'll see that we're working on, you know, a strategy to provide information to all CalWORKs applicants. So everybody who comes on the program can receive helpful information that hopefully will have a preventative impact. Secondarily, some of the more innovative programs that I mentioned, particularly family stabilization. It's a component of our program designed to help stabilize folks who are experiencing crises type situations, homelessness, domestic violence issues, substance abuse issues, etc. Again, sort of on the theme of innovation, home visiting, differential response. And so just the real takeaway here is that CalWORKs can play a critical role in preventing and supporting families across California. So I will sort of stop there because I think our Madera partners are going to be able to provide a lot more real world examples of how a lot of some of this is works. And so I will go ahead and turn it over to them.
Great, thank you, Damien. We will put it there. Department of Social Services in Madera. Thanks to them very much for stepping up to kind of talk about how they are engaging CalWORKs in their comprehensive prevention planning. So Robert, I think you're gonna start.
Good morning, Robert Mikel, Program Manager with Madera County. And yes, in our dive, we're going to talk a little bit more about specifically what Madera County has done and what our goals are for the future as we move more into our prevention, our preventative methods, as well as how best to engage families. I do see in our participation room, we've got some folks from our CBOs, as well as some county folks. And Madera County is not like, you know, the rest of the counties in California, in that sometimes we get caught up in our silos. You know, you've got your child welfare side, you've got your employment services side, you know, your emergency safety net side. And although we are all under the moniker of Department of Social Services, oftentimes we don't know what the other side does and how we can access those resources. So we're going to go into a little bit about what Madera has done and some of our philosophies and things that we do, starting from our new employees and some of our ongoing trainings. So our mission statement here, again, when we have that new employee walk through the front door, they receive this mission statement as part of their induction training. But something that we do on our CalWORKs side, especially with our ETWs, our employment and training workers, is we reemphasize this at our own in-house orientation. And it's, of course, it's to orient that staff to know precisely what it is and who we do, what we do, and who we do it for. You'll see down there in the third paragraph, you know, offering services to protect children, elders, and dependent adults, you know, providing quality. So getting them, you know, getting our new staff just, again, on the right footing, providing that quality services and supporting the clients and achieving self-sufficiency, specifically for my Welfare to Work programs, delivering services in a respectful and effective manner. Again, meeting the clients where they're at, because they bring a lot of things to the table. They bring, you know, stigma, that self-stigmatization oftentimes, you know, with receiving county services. And again, encouraging our staff as they continue striving to maintain professionalism, excellence, and integrity in the work that we do. And again, just a quick overview of our agenda items. Some of the things that we provide are through CalWORKs is our CalFresh, also known as food stamps. You'll even hear our clients refer to it as just EBT. Our Medi-Cal program, our general assistance or GA, child welfare, and some of their supports, as well as adult services. And as mentioned by Damien, our employment services and our Welfare to Work program. So just getting into a little bit of what CalWORKs is, it's our public assistance program that provides cash aid and services to our eligible families. And again, these are families that have children in the home. Families with children, when both parents are in the home, but maybe that principal earner is unemployed. Or you'll see that needy caretaker. So this is outside of juvenile court dependency or juvenile court involvement. You may have that family situation where, you know, an aunt or a grandmother has a legal custody standard, and they come in and they receive services from our county as well. For those children that are dependents of the court, you'll see us talk a little bit more about that when we get to our linkages slides. Right. So our CalFresh program, again, when we talk about our programs, especially here on our services side, and I'm guilty of this too as a program manager and as a supervisor, we oftentimes get caught up in the numbers. How many applications did you process? You know, how accurate were those applications? And sometimes we forget that behind those applications are families. And that's one of the things that Madera County has committed itself to, is that from our program to our supervisors, just talking about the work that we do on that humanistic basis, talking to them about, you know, this application isn't just, you know, again, what we're rating you on your conferences, but the accuracy that we achieve here. This is a family that's going to receive our services. Just 2 weeks ago, we completed our management evaluation review for the fiscal year, and we actually got some pretty good kudos from the state. Just to brag a little bit on my deputy director, we were at 98.5% accuracy for our county CalFresh apps being approved within 30 days. And I think that speaks to, again, our deputy who made it a focus to connect that application to a family. One of the things that she said to us as managers and as supervisors is that when someone walks in that door, when that mom comes in and says that, you know, she and her children are hungry, we move heaven and earth. You know, we do everything we can to make sure that when they hit their heads hit the pillow that night, that those families have food in their belly. So just setting that tone. So again, CalFresh is our program, or state program for people with low income who meet federal income eligibility rules. And again, provides access to healthy and nutritious foods. And again, our program provides help to improve the health and well-being of our qualified households here in Madera County, just to make sure that we know that that's one less barrier that our families in our community have to worry about. Next slide, please. And again, I spoke real briefly about some of the stigmas that are out there and why our families oftentimes don't access services. One of the things that we find is that our clients often feel ostracized, you know, for being poor. You know, they may have feelings that, you know, hey, I don't belong in this doctor's office. I don't have any money. I mean, Madera County, just recently, we lost our hospital. Again, some of the stigmas are, you know, sadly rooted in some fact. Providers may not, you know, may put caps on the number of Medi-Cal recipients that they see that month or at that time, you know, because of the low reimbursement rates, which pay far less than, you know, your insurances, and including Medicare. Again, general assistance. Oh, you're fine, Stuart. You know, and right here on this slide, we just talk about our limits for our family sizes. So if you guys want to take a snapshot of that, just to give you an idea of, for those of you who don't work on the services side of the house, can get an idea of when you encounter those families, you know, where are they as far as their income limits? I mean, be careful with that information. If you feel that a family may be eligible, encourage them to come down to one of our county offices and apply. But this gives you just some ideas about where that family might fall, you know, when it comes to their household income. And then also looking at some of the other diseases that they may have that would qualify them, whether it's tuberculosis, breast cancer, HIV and AIDS, those specific diagnoses will qualify them for our services too. Next slide. And general assistance. When I think about general assistance, I think about those, you'll see that first bullet when we talk about our basic eligibility. Applicant must be at least 18 years of age. I personalize this. I think about my experience as an 18-year-old going off to college, pretty much still being a kid, knowing that I'm going to be supported by my family, you know, for at least the next 4 years. Well, that's not the reality for a lot of our folks in our communities, you know, so they may need that assistance. And again, what general assistance provides, it's 100% county funded for those individuals who may not qualify or are ineligible for federal or state public assistance. We look at different caveats for those that are deemed to be employable. There's a cap on that. 90 days is what they'll get as far as general assistance within any 12-month, rolling 12-month period. Some of the other basic requirements in addition to age is, of course, you must be a resident of the county that you're applying for it in, must be a U.S. citizen or legal permanent resident, must be, again, unemployed or employed with income less than the established grant levels. You'll hear a lot of terms thrown out there like magi and things like that. Go ahead, next slide. And one of the things that we really pride ourselves on here in Madera County is that when our families come in, we help them any way we can. You know, we may redirect them to our online program or online application program. They can, by phone, come in person. And when they come in person, we have no problem sitting down with our clients, have them whip out their smartphone and show them how to access it so that we build that self-sufficiency within them. Go ahead. And without getting too far into the weeds, just some of the other services here in Madera County, we have our child welfare located here on our campus on, what is it, Tozier. We have our child welfare offices as well as our adult services offices, and they provide different levels of service, everything from our emergency response all the way to our adoption and independent living program, as well as working with our non-minor dependents. In our adult services, we provide help or assistance in our IHSS, adult protective services, which is our APS side, as well as our public authority. What I don't have on this slide is we also have our Social Security advocate who will assist individuals with different qualifications with going through the Social Security application process. Not every county has that, but Madera, we're very fortunate to have that here. Next slide, please. In our employment services, our welfare to work, this is one of our, I think one of our best programs here in Madera County. We have an outstanding team of experienced welfare to work supervisors who provide years of experience. One of the things that we look at is personalizing those case plans or welfare to work plans for our family to figure out and to find out from them what is the best path. You know, are they looking at getting back into the workforce? You know, in which case we'll help them with resume writing, just really sharpening those skills. Or are they looking to go back to school? In which case we would be looking at the different education routes too. Go ahead. So our employment services, there are a couple of different activities that are employment services here in Madera that we provide. Community service, they can work as a volunteer. They can take part in our unsubsidized employment. We also have what's called our PACT, our pre-employment activity, and we'll get into that a little bit more because we do have some very specific job opportunities or pre-employment activity opportunities here in Madera. Our expanded subsidized employment, our work study program, as well as our vocational training. If you guys haven't been out to Madera, out on Avenue 12, we have a beautiful new campus, our local, oh man, I always forget, SCCCD, our State Center Community College District. Sorry about that. Where we offer not only that vocational training, but also job skills training. We allow our families to develop those self-initiated programs where they can develop their own education plan with their ETW. again, adult basic education, as well as those families that want to take advantage of our services to go back to school and get that GED or high school diploma. And then we also provide those supportive services, whether it's mental health, substance abuse, or that family who's dealing with domestic violence. Right. So that initial process, when someone takes advantage of our program, one of the things that we give them is they'll have a individualized caseworker that will sit down with them and do an orientation. They'll do an interview. You'll see it down there in that second set of bullets, that online CalWORKs appraisal tool, or that OCAT. It's we try to prepare our clients when they come through the door that it may feel like a mini psych eval, but what it does, it helps us identify any barriers that the family may be experiencing. We'll do that assessment, and then we'll send them over to our career club, which again gives them more information about the programs that we provide, as well as the different paths that they may choose to take. We're very proud of the fact that we do practice CalWORKs 2.0, where we allow our families to set the goals. We utilize motivational interviewing to help them develop those goals, and then also to hold them to those, to assist them to hold them to those goals. Go ahead. And some of the supportive services that we provide are child care. I'll get into a little bit more about that. Also our transportation and our ancillary. And when we think about child care, one of the things that we know is that during early childhood, that those experiences that our kids have, that lays the foundation for their future health and well-being. And the quality of childcare in education, also known as ECE, can have significant lasting effects. So what we know is that high quality childcare delivered consistently can help ensure developmentally sound and emotionally supportive care and education for our youth. Again, this is looking at our program as being preventative. We know that finding affordable, high-quality childcare is a major challenge for many families in California, not just our families that would qualify for our CalWORKs program. Just in Madera County alone, let me see if I could find this stat, as far as what our averages are. For our children that are infants who are in a child care center, the average rate per month is $1,199. So we're a lower socioeconomic county. So you can imagine that that's quite a hardship for our families. For those preschool age kids, as well as school age kids, the average cost is about $798 a month. And you can compare that again to the county that you live in. For those families that take advantage of maybe another family member to provide their child care, even then for an infant, it's about $898 per month. And for those preschool age kids, it's about $759 a month. So that's a pretty, steep haul for any family to try to overcome, let alone our families that are dealing with poverty. Stage one is what we provide here at our Welfare to Work offices for those families that we do achieve their goals. They do become gainfully employed. They then qualify, and their income levels are above our threshold. They then become eligible for stage 2 and stage 3. And we're able to continue providing child care assistance after they're done with Welfare to Work with our local partner, CAPMC. In addition to that, we assist with transportation, which is very important for our county. We are a rural county, so we've got limited public transportation options, and we're when you think about it, we're a very spread out county and with a very diverse geography. We have our mountain communities, which include Coarse Gold and Oakers. We have some of our isolated communities like Chowchilla. We have Madera Metro, and just sometimes the way that counties or cities are built around, I think about Madera's history, how we were built around our train station and just kind of spread out from there. When communities change, and we just had a big change here in Madera, we built our new campus. Our new campus, although you've got a lot of services in one location, it's out on the outskirts of town. So before, when we were located more centralized, families could walk. Now they're dependent on maybe the bus. So we provide bus passes, bus tickets, and then we also assist our families with mileage reimbursement. And then we go by the federal rates for that. And then ancillary is something I always think about, especially working for a county of Madera where we get paid once a month. And you don't get paid until you work your first full month. Think about our families who need those work uniforms, who need those tools, just those work boots. Or we also provide ancillary in the form of education, training, cost of books as well. And there's been changes in the legislature recently where I think it's about $500. If I say that wrong, let me know. But it's $500 that's just put out there now. Whereas before we would go buy books, we would have folks itemize and everything. But now we pretty much knock out those education costs on the front end. Next slide. And I shared a little bit about our PACT program. Some of our PACT partners, for those clients to take advantage of, what some of the benefits of it is their on-the-job training that they can receive, where they can get that opportunity to increase their job skills, learn those soft people skills, as well as get some experience that they can add to their references and build their resumes. We're very fortunate here in Madera County where we do a lot of PACT, provide a lot of pre-employment activity within our Department of Social Services, where our clients can come in and work as clerical. So it's not uncommon that our clients oftentimes become our co-workers. One of our other partners is our First Five Family Resource Center, our Superior Courts, our Government Center, Hines Hospice in Madera and Chowchilla, our Community Food Bank. If we have individuals who are, again, really have a passion for working with animals, we have opportunities at our animal shelter, as well as our behavioral health and our county probation. So we like those folks because we start pushing them towards degrees in that field as well. Go ahead. And currently our expanded subsidized employment, or SEE, we work with a few outside companies and vendors, our UPS store locally here in Madera, our house residential care for those folks who are going into the care services, whether that's nursing assistants, CNAs, the type, our Star Center Adult Care, Camarena Health Center, Valley Fixtures, working in service industry, Wingstop, United Parks, and then working with our one of our local property managers. We're one of property management. And again, what this work experience does is it helps our clients in our community just get more experience. And what we know is that those families that are, a part of their community, are those families that are gainfully employed, they're going to have less interactions with our county because they've overcome so many barriers. In our family stabilization program, this is an area where we've really, in recent years, really have not changed our focus, but we've ramped up our focus to make sure that we're helping those families that do run into problems with alcohol and drug dependency, that may be dealing with domestic violence, which has been an increase since the pandemic, mental health challenges, whether that's for the parent or for the children, life skills and learning challenges, as well as those families that are experiencing homelessness. One of the things that I'm proud of here in Madera County is that we are a housing first follower of, as far as the the federal mantra when it comes to how we approach or deal with homelessness. When we sit down with that family and talk about our different family stabilization programs, from the time that we complete our assessment, so to speak, we lay all the cards out on the table. We let the families know what their options are. We allow the family to tell us, to ask questions about, the different services that we provide. And again, let them tell us, which course that they would like to take as far as meeting their family's needs. Whether it's, they want to take care of the alcohol and drug dependency issues they may be dealing with, or right now primacy, we want to take care of the domestic violence that we're dealing with and how it may be affecting the partner as well as the children. Next slide, please. And then housing assistance. I touched on it a little bit that we are a housing first community, and just so that you're aware, what that means is that as a housing first community, we do follow those 5 core principles. The first one is immediate access to permanent housing with no housing readiness requirements. We don't make it a requirement that you are enrolled in a substance abuse program. If we do find that you have a substance abuse issue, we don't require that you have to go off to our behavioral health to get a mental health diagnosis or receive, pardon me, an assessment first. We look at housing first. We look at making sure that that family has that roof over their head, because what we know is that that family that has that shelter, they now have that foundation where they can go out and meet their other barriers. Again, the second pillar of the housing first model that we look at is our consumer choice and self-determination. And some of that, may be contingent upon or constrained by our availability. But one of the things that we do is we allow our families to help us determine, the location of where they'd like to live, and then encourage them to seek out those accommodations. The third pillar of that housing first, of course, is a recovery and orientation. We have a recovery orientation in that we know that we want to have them stabilize so that they can meet those other aspects of their case plan. It's number 4, it's individualized and client driven. And then 5, again, the most important piece for us is that social and community reintegration. Some of our programs that we have include temporary housing assistance, that's the THA there, permanent housing assistance, our CalWORKs HSP program, our housing support program, bringing families home, which is loosely connected with our linkages. That's the one that we utilize the most to help out those families that may have some child welfare involvement or are at risk for child welfare involvement, to provide some stability in their housing situation. Our HDAP, or Housing and Disabilities Advocacy Program, I think I mentioned earlier that we do have a social security advocate here on our campus, and that's the one that's tied with them, where they'll look at providing temporary housing while we're going through that Social Security application program. The Home Safe program, which is, again, individuals who may have an open or pending APS referral. Our Transitional Housing program, and our Housing Navigators program. And again, some of that assistance you'll see in the form of referrals to rentals, assistance with deposits, maybe paying some back rents. And then also supportive services, including case management to help a family move. Just recently, one of our case managers helped get our clients a washer and dryer and all the hookups. So they were pretty excited about that. All right. No questions, please. I think I stole all of John's time. I apologize, John.
Yeah, so we'll kick it over to John. There is one question in the.
Oh, go ahead, please.
And that, so I don't know if whether you or John can answer this, whether you offer any of the prevention plan evidence-based practices for behavioral health, either mental health or substance abuse. So I don't know if you.
And for us, we will provide referrals to our mental health. And again, that's through our stabilization program.
Okay, great. And I think we'll kick it over to John and see your resources. And John, you got about a little less than 20 minutes. So.
Okay. Next slide, please, Stuart.
Yeah.
I'm going to talk a little bit about linkages. Most counties have linkages. Just to let you know what we're doing in Madera County. So linkages is a collaboration between Child Welfare and CalWORKs eligibility to promote safe and stable homes for children. Next slide. There's 2 ways that they can make referrals in Madera County here. A social worker will complete a form to our linkages case manager when a child is or children are detained with Child Welfare Services. By the way, I'm a program manager in Child Welfare Services in the emergency response, and I also have the hotline. So when I share some of the stuff, it kind of makes sense for you. Social worker will send a completed linkages form to the linkages case manager, and it'll get processed before then. Even before when the child first comes in or children come into the system, the linkages case manager sends out a notice to everybody who's involved in our child and family team meeting within prior to that team meeting to see the eligibility for that family. Next slide. This is just our linkages referral form. So go to the next slide, Stuart. Who is eligible? A case is eligible for linkages when there is a child welfare case and they're eligible to receive welfare to work services. That's the traditional one that we have done forever in the past, because we've had linkages here for several years. So I'm going to interject here, so I'm going to go off slide for a little bit. Because what our linkages team meeting is was we were working through our linkages 2.0 plan, and we were doing our county self-assessment as part of our SIP at the same time. And it was identified, we have a lot of calls to our hotline, I was noticing, that are families that will not do a referral on, but they called us for a reason, or somebody's making a call for a reason. So we now have a process where our supervisor of our hotline will take those referrals. Well, we don't even turn them into referrals, those calls, and triage those calls, and we send them to the linkages case manager, so they can actively be assessed by our eligibility staff. So the referral is sent to them, they call the family, interview them, do the assessment, and have everything so we can provide that family services in real time, versus trying to reduce the number of families that get called on. We all know if you work in child welfare, you have families that get called multiple times or multiple referrals on. And it's, you know, we wanted to reduce that. So next slide. So type of linkages cases, we have the FM, the family maintenance case, the court connected case, our voluntary, and then our court ordered cases. Next slide. So it just talks about family reunifications where a child has been removed from the home. That is more your traditional linkages, where our linkages case manager, she'll attend that initial CFT and the ongoing CFTs with the family to make sure that they're connected to services that they need. And we also will do a coordinated case plan with linkages and child welfare working on it together, and we'll show you that here shortly. Next slide. So that's the coordinated case plan. Linkages case manager and the social worker work together to develop a coordinated case plan and share it with the family. Next. Case manager will incorporate the child welfare services into the plan. We'll provide supportive services. And then we'll also provide advanced support services. One thing that we do at our child and family team meetings, there's a packet that goes in to that meeting. And during that meeting, the family can help identify what services they need. And our social worker will complete a services referral form because I don't know how it is in your counties, but our ER social workers are pretty stressed and we're down staffed. So we looked at how we could manage to get services started quickly without putting undue stress on it. So we work with our support units that the social worker fills out a form saying what services they want the family to get connected to and agree to, and the family signs it at the CFT. And then that form is given to our support staff who make all the referrals, and it's all completed within 24 hours They have people connected up to services, everything from drug testing, which we do in-house. We have drug testing right on site, to drug and alcohol and drug testing. We do referrals to our child advocacy clinic, which is connected with our Valley Children's Hospital, and also with our mental health. It's all done here, and our all those referrals are taken care of right up front. Next slide. So we also work with a little bit, I'm kind of backtracking here, sorry, but we also work with our tribal partners with referrals, any referrals that the family, naturally we're working with them side by side. Madera County, we were blessed to do the pilot project of, we have several ICWA certified ICWA specialist certification program we have 7 of those. Staff who went through that program got certified by CDSS as ICWA specialists. So we work with our tribes, and we also notify them of any families that may need help that we're not going to do a referral on, part of that upfront services. So we're still in a work in progress in a lot of our preventative services up front. We're going to be working with, we're going to be installing family checkup as part of our preventive services right up front. And then we're also looking at our voluntary family maintenance and family maintenance to have workers work with them more coordinated. So I guess back to Robert to do BFH. Bringing families home, Robert.
You got it. Yeah, just to add a little piece to linkages. I know some of you guys might be thinking, linkages, isn't that a tertiary response? You know, as far as, you know, this session I know was more of the preventative processes. What we have also seen linkages be very successful at is limiting or bringing down recidivism, which is, again, a way to keep families from coming back into the system. I know John was sharing with me recently that part of our SIP for our county, our improvement plan, is looking at bringing down our rates of families that are coming back into the system. So linkages is definitely one of those tools that help us, we're hopeful, bring those down when we have those, as we roll out more of our coordinated case plan and providing those services for families, making sure that they're well wrapped once they leave the child welfare area.
We're actually also doing some work on our back end, and when families leave, instead of saying just closing the case and saying, you know, good luck, I don't, you know, that they actually have a plan. We piloted a plan. We placed a child in with a family in Mississippi and did a complete plan with mom. She's called us back and just raving about how it was so easy with the plan in place. We got her everything that she needed, what school she was going to connect with, what services she would connect with. So we are taking that same thought process, and when we're closing a case, we'll be providing a plan for that family that's pretty intense. And we do it with the family. It's a coordinated effort. So more to that, more to come on that one.
All right, go ahead, Stuart. Next slide for our Bringing Families Home. And again, Bringing Families Home is our flagship homeless housing or housing assistance program that we provide for those families that are already involved in child welfare, but may be experiencing homelessness. And as the slide says, you know, helping them secure housing, making referrals to potential rental properties, and provide supportive services to help families move towards income and housing stability. We do have one dedicated linkages worker as our cases are, as homelessness is starting to sadly grow here in Madera. We do see the need for at least maybe another linkages worker and some staff supports. But right now we just have one linkages worker. Go ahead, next slide. And who is eligible? Again, families that are already in the child welfare system experiencing or at risk of homelessness. Again, if it's something like they may be needing assistance with their PG&E, or they may need that washer and dryer. We recently had a family that had, sorry if this grosses some of you out, a pretty bad rat infestation, and we were able to help get exterminator services as well as do some home repairs. And then we'll also look at families on a needs basis, on a case-by-case basis. They may be a child welfare client, but they may not previously have received CalWORKs, but so they wouldn't qualify, so to speak, for linkages, but bringing families home is a housing program that could be extended to those families as well. Go ahead. And again, the referral process is similar to the one that John showed you. The referrals can be made by any of our DSS staff in any of our buildings, from our health department to our adult protective services, child welfare, as well as our welfare office here on campus. Again, we just provide some local information about where to send those. And again, making sure that in those referrals, our linkages workers will be reaching out to our CBOs as well. Next slide.
If I can chip in there real quick, Robert, too.
Yes, please.
That referral is also made out of emergency response. Once that case is getting ready to be transferred, we'll do a referral. So right up front, we're making that referral for that homeless, even though that family may not be together for a while. We tap into the BFH funding.
And that linkages worker is our primary BFH case manager as well, who does all the screening of those families. Next slide, please. And then the services that I mentioned that are provided through bringing families home, BFH, rental subsidy, any moving assistance, any costs for repairs, rents or utilities that may be in arrears, furniture, as well as that intensive case management that our linkages worker provides. Some of the barriers that we see in Madera County, again, lack of availability, lack of units. Also, our families may have low or no income. So the connection that we can have with our linkages, ETW, with our services, it's easier when the kids are either on a plan of family maintenance or in the home, because then we can get them receiving our employment services, maybe even qualified for our welfare to work program. Of course, little or no credit is another barrier that our families often face here in Madera County. Previous eviction history, or maybe even no rental history. Criminal background, certain crimes will, you're not able to take advantage of the housing, especially if you have like an arson or something like that on your record. Any lack of recent employment history, because what we know is that our renters, as well as our management companies, I mean, they want a good client. We can provide some assistance for our families, but ultimately it's our managers that are going to make that final determination whether it's a good fit for them to take on our clients. I did see a question, I think it was a follow-up question to our motivational interviewing question. The question was, are our case managers trained in motivational interviewing? Yes, they are. All of our welfare to work ETWs and that's employment and training workers, as well as their supervisor trained in motivational interviewing. The follow-up question, monitoring the fidelity of motivational interviewing by the users. We could do better. One of the things that I'll be speaking with one of our training supervisors is maybe making it an ongoing training, something that will go into maybe on an annual basis at least, to make sure that we still have those tenants and are practicing it. And then as managers and supervisors are using it with our subordinate staff, that we're providing solid ideas on how best to utilize motivational interviewing. And as the manager, I can definitely follow up with that one.
Great. Thank you so much. So we have a couple of minutes left, and I wanted to just kind of sum up what's the point of the conversation, why we're all here. what we've heard is that CalWORKs has a tremendous array of resources, services, and supports that can help families, can help keep families out of the child welfare system, and for families who've come into the child welfare system, help them resolve the issues that brought them in to get them out. So again, our theme is all about comprehensive prevention planning. If those of you in other counties other than Madera don't have your CalWORKs and if you're a linkages county, your linkages staff involved in your comprehensive prevention planning, I think hopefully you've realized in this session that you're missing a great opportunity. Comprehensive prevention planning is all about getting resources to families so that they can help themselves, so that the community can help them and keep them out of the child welfare system. Like I say, when you hear about all these resources, think about the ways that in your comprehensive prevention planning, you might bring these to bear in the ways that we've heard Madera. I mean, Madera is such a great example of how you coordinate those supports that that families need with the child welfare system or the prevention system to make sure that families really get those supports. And for those of you who've been involved in linkages for a number of years, we've always put forth our mantra, which is the greatest prevention program in California or in the US really is our CalWORKs or TANF system. So we hope that folks have kind of heard that message, heard from the state what things are available at that level, heard from Madera how you can coordinate your services and really make sure that families get those. So I kind of wanted to sum up with that, and we have just a minute or two if folks have any other questions. We've been trying to watch them in the chat, or anything that anybody would like to contribute. Come off mute.
I did want to mention or go back to Lisa's stats that she provided regarding CalWORKs in California. And just to give you guys something to think about, she shared that 6% of CalWORKs clients are referred to child welfare. But think about, what does that really mean? I mean, does that mean that CalWORKs is doing such a great job that only 6% are showing up? Because those families have those resources, they've had those barriers met. Or could it mean that that number, I think Lisa was alluding to, it needs to be a little bit higher because we don't have enough families that are coming in through those assistance program doors because of the social stigmas that they may be dealing with. So again, just something to think about, and definitely to piggyback more on what Stuart was saying, reach out to your partners. I mean, I'm very fortunate to have worked on both sides of the house, so to speak, both in child welfare as well as in our services divisions. And I see how we can work together as a team to make sure that we provide the best outcomes for our children and families.
Great. Go ahead.
Oh, I was going to mention that, and the key is getting connected right off the bat for child welfare. We have our our eligibility case manager sitting right in those initial CFTs, hearing what the family has to say and getting them connected with whatever that need. That's really critical. Great.
Okay, well, I really want to thank Lisa, Damien, John, and Robert. Great presentations, great sort of overwhelming amount of information. The presentation is in the Google folder. You all have received information about the Google folder that has all of the presentations from all of the workshops, but this presentation in particular. So a lot of great information in there, a lot of great statistics. So I encourage you to spend a little time and share it with your county partners. So thanks, Cindy, for that round of applause. We appreciate that. And thanks, everybody. I think we have, it's time to go back. So thanks very much.